Welcome to AHS Health Matters, where we talk to local health and wellness experts and learn more about how to live a happy and healthy life. On today's episode, we're going to talk to registered dietitian Heather Mathur. As we approach the holiday season, we often think about large family gatherings and big turkey dinners, but she's going to give us some advice on how to have a festive meal when cooking for only one or two. We'll be right back with Heather. Welcome back. I'm now joined by Heather Mathur, a registered dietitian with Alberta Health Services. Heather, when we think about Christmas, we often imagine large family gatherings, big turkey dinners, but for some that may not be the case. Do you have any tips for smaller festive foods?
Yes, eating alone, it can be quite common actually. Statistics Canada in 2018 found that 30% of Canadians eat all of their meals alone. So that's 1 in 4 Canadians that often eat their meals alone. So it can be more common than people think to be eating alone with 1 or 2 people over the holidays. But it doesn't mean that you want the season to be less festive or the food that you cook or eat to be less enjoyable too. So there's many ways to make the season bright without having huge family gatherings. So enjoying and keeping the season festive, fun, and delicious can be simple and stress-free too.
So why is it important to enjoy and treat yourself over the holidays, even when cooking for just 1 or 2 people?
Part of having a healthy diet is actually enjoying the food that you're eating and enjoying the atmosphere that's around. And a lot of people don't realize that enjoyment is a part of healthy eating. Ways that you can make it special can be simple, like I was saying. So simple things like just adding on a seasonal tablecloth. Having some candles to light when you're dining, having a festive centerpiece, turning on some of your favorite holiday music or just music can make the meal and environment a little bit more enjoyable and festive. Also, some other things to do could be to invite someone over for a meal that you're making too, or go out with a friend too if you don't feel like cooking to enjoy a meal together. Part of enjoying your meal can be having company around you and that conversation too, which a lot of people don't think about when they think about healthy eating, but it is a big component of healthy eating.
So what are some smaller scale festive meal ideas that you have for people celebrating with just 1 or 2 people over the holidays?
So smaller scale holiday meals for 1 or 2 can still be festive. Even if you have some larger, more traditional recipes that you make, you can usually freeze those items. You could also, gift those items to other people. I know some of my favorite gifts are getting homemade salsa from my neighbor, or a holiday snack mix from the neighbor too. I have to say that was one of my most favorite gifts from my neighbor. He lives alone, so he does some really good cooking. So that's a way to still enjoy the season if you do have those larger scale recipes, but then they don't always have to be larger scale. So think smaller scale, like Cornish game hens can still be festive and special, but you don't have as much left over like a huge turkey to make. You can get a turkey roll though too, and a simple like mash or a baked potato in the microwave, if you don't feel like cooking too, or some other ideas. We have a lot of recipes on the AHS Inspiring Healthy Meals, like easy cabbage rolls. We have a maple, turnip, mashed potato, parsnip dish, some slow cooker fruit pudding that's easy to make and delicious, and bruschetta. You could make a homemade bruschetta. You could also buy some from the store, but that kind of makes it a little more seasonable and special.
So some great ideas for smaller meals, but for folks that still want to make that turkey and they're left with all those leftovers, what do you have for suggestions for using up the leftovers afterwards?
So be creative. There's a lot of ideas out there. If you have leftover mashed potatoes, you can use them in a frittata or to use in pancakes or use them in a soup or make a casserole. If you have leftover herbs or vegetables from the meal, you can use some low-fat cheese to make a quesadilla or a pizza or an omelet. If you have some steamed or sauteed vegetables, you can add that to pasta or make a mac and cheese with those vegetables. If you have leftover turkey, you can use them in chilies, soups, stir fries, casseroles. That's kind of endless what you can do with that. You can make a turkey and brie cranberry sandwich, which is delicious. If you have leftover rice, you can use that in a stir fry, just using garlic and ginger and some soy sauce, which is quick and easy. If you like shrimp during the holidays, you can use that in a taco with some coleslaw. You can also use that in a wrap for a sandwich. So really the possibilities are endless.
Well, I'm certainly getting hungry. There's a lot of great ideas there. One of the things that you've mentioned a few times is that part of healthy eating is connecting with people. So do you have some suggestions on how we can connect with our friends and family that maybe live a little farther away?
Yeah, well, something fun, and I did this last year. My aunt actually paid for a cooking session. I'm Norwegian, so we made a traditional lefse recipe. So that was a nice treat. But you could do that with friends and family to join online. You could do your own cooking demonstration, sharing your own traditional holiday recipes. This session actually was a man who had lost his mom, who never had a chance to pass down that traditional recipe. So actually he leads that class now, so other people can learn about that traditional recipe. So it can be fun to join people from far away virtually. There's classes too to take as well, like AHS has our wellness kitchen. They have cooking when fatigued with a lot of ideas if you don't have the energy to cook too. So there's a lot of simple ideas. So searching that out to think outside the box. But that was for me, that was a really fun thing to do last Christmas, to join family that I haven't actually seen in years from across Canada.
That's wonderful. You've shared so many different ideas and recipes and classes. Where can we find more of this information online?
So for recipes and classes, you can go to ahs.ca/nutrition to find recipes, resource ideas, and then for classes like the online class, the Wellness Kitchen class will be there too. As well, Canada's Food Guide has a lot of recipes to check out too. And Unlock Food, which is another website, a Dietitians of Canada website, has some cooking for 1 to 2 tips.
Thank you so much, Heather. This is great information. We're all going to have a happy holiday, whether we're with 1 or 2 or a large family. Thank you so much. Welcome back. I'm now joined by Daman Saimbhi with the YMCA Memory Trekkers program. Hi, Daman.
Hello.
What is the main goal of the Memory Trekker program? Can you give us a quick overview?
So Memory Tracker program is mainly performed for dementia and Parkinson's and Alzheimer people, and it is a program for them to socialize with each other and make them comfortable to walk and talk with each other.
As a program instructor, what are your main roles and responsibilities?
My main role and responsibility is that they are performing exercises in a safe and sound environment. It helps a lot, like they feel really safe here because while they're walking, there's no trip overs, the track is clean, and they feel really safe.
So, how do walking programs for dementia-friendly individuals improve the health of older adults?
So it really helps them to maintain that balancing, because I have seen so many people with dementia, Parkinson's, or Alzheimer, they have a little bit of, they're out of balance when they're walking. While walking on the track, The track gives them a line. For example, walk on the line, walk on the yellow line, or walk in between the lines. And it helps them to build that stamina and strength as well.
And so, how does the program work? How often do the walks happen? How long are they? Is there some way of tracking progress?
So the program happens 2 times a week, Mondays and Fridays. It starts at 10:15 till 11:30 or 11:15. We first start with a quick warm-up, and then we go to track, and we usually track the laps on an iPad or on a notebook, and we have all the names written there. And in between, they can take breaks as well. Also, it's up to them how much they want to walk. It totally depends on them. We try to motivate them that yes, now you can do one more, and they really like it and they feel motivated as well. Yes.
So, how does the program encourage socialization and support connections within the group?
So right now I think we have around 8 people. It helps when they come and talk to each other in the end of the walks. Like we have a chit-chat session, and we drink coffee as well in the end. I always try to bring some snacks also for them. And so we always play a game in the end. And I try to shoot something from past or future or what they are doing in the present. For example, what's your favorite memory of your childhood? They start talking about that. And they have so much, like, all the people are different there, and they love sharing their experiences. And it is a way how they socialize with each other. Yeah.
Can you share any positive stories from participants that have been in the program?
So there are a lot of positive stories, but one which I would love to share is that we have a couple, and so so they both come here for walks with us, and so one of them was not able to walk without the cane, and when they started the program, they were able to walk without cane. They were pretty confident in walking on the track because he was happy, he was not tripping over things. And in the end, when we share our stories, they laugh a lot. They love teasing each other, and they are so much comfortable with each other. Yes.
Great. So, how can people learn more and sign up for the Memory Trekkers program?
So if you want to sign up and want to learn more, everything is on our website. You can sign up online or on the membership desk. They can help you with that.
Wonderful. Thanks so much for sharing all the information about the program, as well as all those positive success stories. Thanks for being with us today.
Thank you so much.
Welcome back to AHS Health Matters. I'm now joined by Lauren Slavik, a community developer with Healthy Aging Alberta. Lauren, what is Healthy Aging Alberta?
Healthy Aging Alberta is essentially a network of community-based senior serving organizations that are working to improve the lives of seniors across the province. And when I say community-based senior serving organizations, which is a mouthful, what I'm referring to are those organizations that are providing services to seniors at the community level. So a lot of the times that looks like an FCSS, that looks like a local library, that also looks like a senior center. And so a lot of these organizations are providing those commonly known services that we know that look like pickleball, it looks like crib, it looks like bingo. But what we don't realize is that they're also providing crucial services like single session counseling and coffee chats and housekeeping and things that really keep seniors well in their homes. And so at Healthy Aging Alberta, we really know that this network, this community-based senior serving sector really fits into the whole continuum of care for seniors. It's not just healthcare and housing, it's the broader picture.
Can you give some background on the Healthy Aging Initiative and why it was developed?
Yeah, so it was a co-creation approach. So back in, I want to say 2018, 2019, there was a sector engagement project. And so it brought together these 4 organizations out of Calgary and Edmonton. And they came together and they realized that the sector is really disjointed in providing services for seniors. And at about the same time, the government, the Ministry of Seniors, Community and Social Services also realized this disjointment. So together they have this co-creation approach that essentially looks at how to enable and empower seniors to age in their own homes. And it also engages communities to work together, to look at all the challenges that they're seeing, all the successes, all the things that are working really well. But also these conversations were also inspired by BC's work. So in BC, they have what's called Healthy Aging BC. And so what they've been doing is they have these programs like Better at Home. And Better at Home really provides these services like day-to-day tasks, this like light housekeeping, snow removal, yard maintenance, all these things that help seniors stay in their homes and communities longer. And so these programs like Better at Home, when they're integrated into the broader spectrum of care for seniors, it creates a really like a holistic approach to their care. It's not just their healthcare needs and their housing, but it's everything in between as well.
Can you talk a bit more about the holistic approach that you just mentioned in supporting older adults? And do Albertans have a Better at Home program like you just mentioned BC has?
So not quite. So Healthy Aging Alberta has been collaborating with the government of Alberta. Healthy Aging Alberta has been playing more of a backbone role. So they've been working together to essentially allocate funding from places like the government of Alberta, from the Ministry of Community, Seniors and Social Services, and from some anonymous trusts. And they've been allocating the funding on behalf of the community-based senior serving sector into communities. And so those investments can look a few different ways. So it can look like the non-medical supports that we see like Better at Home. So it can be expanding a Meals on Wheels program. It can be hiring a navigator within communities so that seniors have a person to go to help navigate them through all the services that they may need. Another investment looks like social prescribing. And so we use this term, it kind of connects those we call extra services from the healthcare provider into community. So if a healthcare provider like a pharmacist or a doctor recognizes that a senior may need a little bit of extra help around the house, they can connect them to somebody in community like a link worker, and that link worker can say, hey, let's sit down and create this care plan for you. We can look at all the extra needs and kind of get you set up for everything that you may need outside of healthcare. And then the other investment that we've been working on is assisted transportation. So not just getting to medical appointments, that's critical for a lot of seniors. They need to show up for their appointments, but they also need to get their groceries, and they also need to meet with friends, and they also need to get their hair done and make that, Thursday crib game at the senior center. All these things that are really critical to what they're doing. And so with these investments that have been going into communities, Healthy Aging Alberta has been setting up what we call communities of practice. And at the communities of practice, those invested communities have a representative who comes to the table, it's a provincial table, and they talk about what's going well in their program. So if they're having issues or challenges, maybe another community is having the same challenges or issues. And so they can talk about how to tackle that, and if things are going really well, maybe we can replicate this in another community in the province. So it's really a place to learn from each other, it's a place to discuss the challenges, but it's also a place to come together to evaluate the programs and see long-term what's going on. So all of these things are really focused on looking at the senior. The senior is really at the heart of the work. So.
The communities of practice sounds like a great way to bring together all these different organizations that work in the sector and touch the lives of seniors. But how else can people get involved? How can people find more information? How can they help with these connections to share and learn from each other?
There's many ways to get involved, and we say there's always a place for people wherever they want to get involved. It can be as simple as going on the website. So we have a website. It's corealberta.ca. And so on that website, we have plenty of opportunities. We have learning sessions, we have information, we have events. We also have groups that target specific topics. So if you want to look more at elder abuse, there's elder abuse information, there's falls prevention, there are caregiver supports groups, all of these things that really you can come together and use it as much as you want or as little, if it's a weekly thing or a monthly thing. let's say you're a working professional working with senior organizations, another option is to just subscribe to the newsletter. So the newsletter comes right to your inbox with all of the great information that highlights everything for you. Another way is what we've been doing recently is these annual regional gatherings across the province. So in different pockets, so there's a couple in the south zone, a couple in the north zone, and the central zone. So all across the province, we have these regional gatherings once a year, and we come together to discuss things that are important to us in our region. So they're tailored specific to what's going on there. So in the south zone, we could talk about social prescribing like we did last year when we met in Lethbridge and also in Medicine Hat. We come together for small table discussions, so that's an annual way to get involved. And then I also have to mention that you can always reach out to me. So I represent the South Zone, so I'm happy to meet up and talk about some of the challenges that are going on in the senior sector, but also what's working really well. So it all starts with just a simple reach out and let's have a chat.
Great. Well, you've certainly piqued my interest. I learned a lot today that I didn't know was even happening in the senior sector. So thank you so much for joining us and sharing all this information today.